My right, Melissa DeRosa, Secretary to the Governor. To my left, Dr. Howard Zucker, Health Commissioner of the State of New York. We are joined by my colleagues today, Governor Murphy from the great state of New Jersey, Governor Ned Lamont from the great state of Connecticut. It's a pleasure to be with them again, and we have a joint announcement that we're going to make. First, I want to personally thank the governors on behalf of myself and behalf of all the people of the state. They've been extraordinary colleagues through this situation. We've been mutually supportive and mutually helpful beyond the normal government relations or political relations. This was a situation that nobody had really faced before, and I can tell you that they were personal comforts and sources of strength for me, and being able to talk through this situation with them and come up with coordinated plans really made a difference. And there were no states that were handed a worse hand, if you will, when this started than our states. Remember what happened. We had some of the highest infection rates because we had people coming from Europe who brought the virus. They trace our virus in this region back to Europe. And we had a federal government that told us the virus was in China, it's in China, it's in China. It wasn't in China. It had left China and went to Europe, and then it came here from Europe. January, February, March, 3 million Europeans came into our region of the country, and they brought the virus. And by the time we found out, by the time the federal government figured it out, we had viral spread all through the community. So we had the highest numbers to deal with in the country. And you look at where we are now, we did a full 180 degrees. We went from the highest cases, the highest viral transmission rate, to some of the lowest rates in the country. No one else had to accomplish as much as we had to accomplish in such a short period of time. No one else had to bend the curve as much as we had to bend the curve. And when people take a deep breath and the political rhetoric dies down, those are going to be the facts. So I applaud my colleagues for doing an extraordinary job. We now have to make sure that the rate continues to drop, and that's what keeps me up at night, and I'm sure keeps them up at night. So we have to make sure we're doing everything and we're diligent and our citizens are diligent. We also have to make sure the virus doesn't come in on a plane again. Learn that lesson, been there, done that. So we're announcing today a joint travel advisory. People coming in from states that have a high infection rate must quarantine for 14 days. And we have a calibration for the infection rate, and any state that goes over that infection rate, that state will be subject to the quarantine. It's only for the simple reason that we worked very hard to get the viral transmission rate down. We don't want to see it go up because a lot of people come into this region and they could literally bring the infection with them. It wouldn't be malicious or malevolent, but it would still be real. So we are jointly instituting that travel advisory today, because what happens in New York happens in New Jersey, happens in Connecticut. And I think it's right, and I think it's smart, and I'm glad that we're doing it together. And we've done a lot of good things together, and hopefully we're on the other side of this mountain, and we'll continue to see the numbers go down, and we'll continue to see the economic activity go up. And with that, I'm going to turn it over to my neighbor, Governor Phil Murphy. Phil, thank you again for everything. Thank you for what you've done, not just for New Jersey. Thank you for what you've done for New Yorkers. And there's no doubt that our partnership has made it better for both states. So thank you very much, Governor Phil Murphy.
Andrew, thank you. And I echo your words of thanks and deepest appreciation for the partnership with you and with Ned. You know, we live in the densest neighborhood in America. We've been clobbered by this virus. No region in the country has paid a bigger price with the loss of of brothers and sisters. We've lost just under 13,000 members of our New Jersey family. New York has paid an enormous price. Connecticut has paid a big price as well. And I can't thank you enough for your partnership, guys. We need to do things right by inside the four walls in our respective states. We need the federal government, but boy, have we needed our neighbors. And I can't thank you and Governor Lamont enough for your partnership and the spirit of teamwork in this extraordinary chapter in our state's and our nation's history. Listen, my echo is simple. This is a smart thing to do. We have taken our people, the three of us, these three states, through hell and back. And the last thing we need to do right now is to subject our folks to another round. And this virus is risky enough on its own in terms of the potential to flare back up. So doing something common sense as this is, to say to folks, listen, it's time for personal responsibility. If you've been in a state that has a high infection rate, do the right thing. And that is taking 14 days and self-quarantining. It's the right thing to do. It's the common sense thing to do. It's the responsible thing to do. So I'm honored to be alongside my fellow governors today and support this notion wholeheartedly. And I know the details will come from our respective health departments on exactly what this means, but it's a really smart, common sense step, particularly as we have the three states have really broken the back of this virus. Thank you again for everything and for having me today.
Thank you. Thank you very much, Governor Murphy. And again, I do believe we're all on the other side of the mountain, but we determine what happens. It's what our people do. It's our policies. And it's not over until it's over. And I think it'll help us all. Thank you very much, Phil. And our other colleague and partner, Governor Ned Lamont from Connecticut. Governor, thank you very much for your partnership. Thank you for the personal support and personal friendship you've given me. Nobody wanted to go through this, but you see sometimes in life when the pressure is on, you see the best and the worst in people and society. And I think we saw that here. And one of the high points, one of the best facets that came out of this was strong people got stronger and strong relationships got stronger. And New York and Connecticut and New Jersey really stood together. And I want to thank you very much. Governor Ned Lamont. Technical glitch. Can we get Governor Lamont back? One second for Governor Lamont. Let me give you some details. Oh, here he is.
On a jet airplane, but it's not going to leave on a jet airplane. It only goes by working together with New York, New Jersey, and the other states in our region to make sure that we maintain the protocols, the social distancing, the masks, everything we have done successfully over the last few months to bring our positivity rate to less than 3%. And I got to say, I'm blessed to have you guys as fellow governors, as well as Rhode Island and Massachusetts. The Northeast region has taken this seriously, and that's allowed us as a region to power through and get our positivity rates very low. But we're not an island. And as we look around the rest of the country, we have seen not just spikes, but we've seen real community spread, better than 10% positivity rate in a number of these states that we're talking about right now. And if it was limited to, the nursing homes or the prisons or something containable, perhaps we would not be as concerned. But right now we're seeing, places within some of these states where you have a positivity rate of 20, 30, 40%. In many cases, younger people, folks who travel 18 to 35, who are maybe not at risk themselves, but are highly infectious. So, working with Phil and Andrew over the last, week or two, we're reluctantly came to the conclusion that this is what we've got to do to make sure that our region stays safe and our state stay safe as we make sure that we can safely get our businesses back and our schools back up and operating, this fall. And we'll be monitoring this carefully. We've got the quarantine in place. We'll be doing publicity and social media, reaching out to the travel agents, doing everything we can to tell people, if you come to Connecticut, you come to New York, you come to New Jersey, you come safely, and you follow the protocols, starting with the quarantine. Andrew, Phil, great being with you guys.
Great. Governor Lamont, same here. Thank you very much. And hopefully we're on the other side and we stay on the other side. Governor, thank you very much. Ned, thank you. Okay. Let me give you a couple of more details on this. The infection rate formula will be 10 per 100,000 on a 7-day rolling average, or 10% of the total population positive on a 7-day rolling average. So any state that has an infection rate above that would require a 14-day quarantine. As of today, the states that are above that level are Alabama, Arkansas, Arizona, Florida, North Carolina, South Carolina, Washington, Utah, Texas. That's as of today. The states themselves can change as the infection rate changes. And we will update daily what states are above that infection rate. But as of today, those are the states that are above the infection rate. And again, it's just common sense. It's the spirit of community. If you're in a place that has a high infection rate, we understand that, and we'll help you any way we can. And we've been helpful in reaching out to every state across the nation. But we don't want to see the infection rate increase here after what we've gone through, and that's the 14-day quarantine. That is a uniform policy across the 3 states. Each state will be responsible for the enforcement of that policy within their state. Let me give you a couple of other facts as we're here on day 116. The number of hospitalizations is 1,071. That's the lowest level of hospitalizations we have seen since this nightmare began. And again, when I say we're on the other side of the mountain, sometimes I'm talking to myself. I'm often talking to myself, but this is the mountain I'm talking about. We're on the other side. We're on the decline. We just don't want to see us reverse, and we are at the lowest level we have been on hospitalization since this started. We paid a very dear price for it. Our tests, we did 58,000 tests yesterday, highest number of tests in the United States. Without the tests, you don't know where you are. We're at a 1.1% positive. You can see the testing by region, and all the regions are constant since the reopening, including New York City, which we're watching very carefully. But we watch it on a day-to-day basis, and right now all the numbers look good. Within New York City, we look at the numbers by borough. We also look at the hot spots in the boroughs. We know that there are some zip codes that are much higher than other zip codes, so we also study those hotspot zip codes. The number of deaths is 17 today. This is right about where the lowest numbers have ever been. And again, that's more great news. And again, we don't want to see these numbers reverse. Number of lives lost on the 3-day average, again, is just about as low as it's ever been. So all the numbers are good. What we're doing works. Our approach has been vindicated, and the phased reopening by data works. I said from day one, I think these states and this theory of handling it politically, it doesn't respond to political theory. It responds to science and data. So we're going ahead on Friday. Those are the 5 regions on the map. On phase 4, we have low-risk outdoor arts, low-risk indoor arts entertainment, museums, film and movie production, higher education, and professional sports. By the way, the spring training for the Yankees and the Mets starts July 1 in the great state of New York. I spoke with the League Baseball on the protocols that are in place. Phase 4, we're going to increase the number of people who can be at a religious gathering from 25 to 33%. We'll also increase the number of people who can be in a social gathering from 25 people to 50 people. We are continuing to study malls, movie theaters, and gyms. There's new information that comes out on this virus every day, and the most recent developments, we're looking at what happened in other states. There's some reports that malls, bars, certain social clubs with air conditioning, that air conditioning may not be cleansing the air of the virus and just recirculating the virus. So we're studying that. The highest number of riders since this started, the MTA subway system. You know, there can be a silver lining in the middle of a storm. The system is cleaner than ever. I am a lifelong New York City boy, New York City person. And I've seen the subways. And we've had numerous discussions on how to clean the subways, and the subways are dirty and they should be cleaner. They are cleaner than they have ever been, period. Period. I defy anyone to find a time when the subways have been cleaner. Remember, we were talking about trying to clean them. Get out the old newspapers, coffee cups, etc. We were, for years, stymied to help the homeless who are on the subway system, which was really a terrible crisis for the homeless and for society. They are now cleaner than ever. They are literally disinfected. Forget cleaning. They are literally disinfected. And that is a positive that has come out of this. And I applaud the MTA for doing it. To disinfect the subway was not a simple task. You have to figure out how, what equipment, what technology, what's safe, what chemicals, what's safe for the employees to put down, what's safe for the riders the next morning. But they did it. On the reopening, we had a great debate in this nation as to how to reopen. Well, reopen fast, government shouldn't be in the way, this is all overblown, this is just the flu, reopen. Okay, some states did that. There was a different theory that I advocated, this state followed, which is it's a virus, don't use political rhetoric, use science and metrics, and phase the reopening by the data. The results are in. We tested both theories. The argument's over. Two different theories, we tested them. And now we know what happened. The reopening, done smartly, done intelligently, done on the data, is better for the public health. We saved lives, and it's better for the economy. It was never a choice between saving lives and reopening the economy. It was always, you have to do both or you do neither. The concept that you could open recklessly, see the virus transmission go up, and think that was going to be good for the economy was bizarro land. And you see that today, because you see states with an increasing viral spread. It's up to about 27 states that now have an increase in the virus spread. And you see the stock market going down every time the virus goes up. Why? Because it was never one or the other. And now you see countries around the globe saying, we may not want to travel to the United States because of the virus. The only way to get the economy back was to have a smart reopening plan. That was always true. And now the proof is in the pudding, because we're seeing it all across the board. And what New York is doing is counter to what you see across the nation. They are going up and we are going down. 27 states going up. So, nationally, we should admit the reality. Denial is not a life strategy. It never is. Those 27 states are going up. More people are being infected, and more lives will be lost. They're offering excuses. Well, it's because we're doing more testing that the numbers are going up. That is just factually not true. The numbers aren't going up because you're doing more testing. The numbers are going up because more people are getting sick. You know how more people are getting sick? More people are going into the hospitals. When more people are going into hospitals, you know what it means? It means more people are getting sick. And don't tell the American people anything different. They know that when people go to a hospital, it's because people are sick. And you look at Arizona, you look at Texas, you look at all these states. You know what you see? You see an arrow going up because it was misguided to say we're going to reopen the economy. What you're doing is you're putting people's lives in jeopardy and you're hurting the economy. New York is the exception. Dr. Fauci, who is one, in my opinion, one of the sane and smart voices in Washington, yesterday said that New York is an example of actually doing it right. In New York, we have to remain vigilant. Everybody has a role to play, individuals, businesses, and government. Look, this is a different moment in history. Government has to work now. This is not normal politics, political rhetoric, tweets. This is government actually having to perform a job. Government people expect government to work now. You see how engaged people are, how they're following government? And they know when it works and when it doesn't work. Their complaint with the federal government right now, they have been incompetent in how they handle the situation. Because they have been. And local governments have a role to play. We have to keep that infection rate down. The key to that is the local governments being diligent on compliance. And I have this conversation with local governments all across the state 5 times a day. The state is in charge of opening or reopening. The state put the metrics in place. The state closed down the businesses. The state is responsible for reopening. Local government has no authority. That took a big political burden off the local governments. Nobody wanted to shut down the economy. The president didn't want to shut it down. Nobody wanted to tell people to stay home. Okay. I took the responsibility for shutting. The state has the responsibility for reopening. Local government can't shut anything. Local government can't reopen anything. They can't shut a school. They can't open a school. They can't shut business. They can't open business. That's all the state's responsibility. And I assume it 100%. And I get 100 phone calls every day from angry people who wanted this open or this opened or this opened. Okay. Local governments have a responsibility. They have to ensure compliance. Social distancing, mask wearing, businesses following the rules. Bars, restaurants, people on sidewalks, local government has to do that. I understand it's not easy. I understand it's not popular. Welcome to government in the middle of a global crisis. They have to do that job, and they have to be competent at doing that job. The worst case scenario, which is what Governor Murphy just said, after we've gone through hell, imagine if we have to go back and do it again. The other piece of the equation is people have to do their part. You know who bent the curve in New York? New Yorkers. Nobody else. They wore the mask. They did the social distancing. They did it. Weather's warm. The news is good in New York. Yes, it is. But that does not mean people can now relax. The news is good because we did what we had to do. The news is good because we were New York tough and smart and united and disciplined and loving. And we have to stay New York tough. Especially you, Zach. Questions?
Governor, how will this quarantine be enforced? How will the states actually check if travelers are abiding by the quarantine? How will, travelers crossing state lines, be accounted for?
Each state will do its own enforcement mechanism. In New York, it's a travel advisory. You are informed that you should quarantine for 14 days. If you go to a hotel and a hotel clerk asks, how come you're not on quarantine? You go to a business meeting and somebody says, aren't you supposed to be in quarantine? You're stopped by a police officer who says, you're driving a car from Connecticut, from Florida, license. Weren't you supposed to be on quarantine 14 days? Any of those mechanisms, you can be detected as violating your quarantine. If you are violating the quarantine, you can be subject to a judicial order and mandatory quarantine. You could have to pay the costs of quarantine. There are also fines that can go along with violating the quarantine. $2,000 for the first first violation, $5,000 for the second, up to $10,000 if you cause harm.
In Florida, for example, the National Guard has been sent to greet New Yorkers flying in. Is that something you're considering here?
We're not at that point.
And when does it take effect?
Tonight, 12 o'clock. So get on the flight quickly. You have to do these quarantine. If you don't do it almost immediately, federal government made this mistake. If you give people time, what you actually do is you force people to rush back, and people panic and try to come back before the ban was implemented on the federal side. So you had a lot of people crashing the airports at the last minute. Now, this is not a ban. You can come back, but you have to be quarantined. But it's better to implement it quickly so you don't cause a ruckus at the airports.
Governor, is this just symbolic?
No, you violate the quarantine, you will then have to do mandatory quarantine and you'll be fined.
But you're not stopping people anywhere.
I'm sorry?
You're not stopping people anywhere. You're not really
No,
checking.
quarantine doesn't stop people. None of the
Stop people.
No, none of the quarantines have stopped people. It's not that you've ever prohibited someone from entering a state. That is not a quarantine. That is a blockade. That's what the federal government threatened to do to us at one point. And I said that would start a civil war. That is, you cannot leave the state of New York. That's what the federal government was talking about. That is a blockade. It's not been done since the Civil War. There has been no state that has said you cannot enter our state. I don't believe that would be constitutional. A state can say, as a matter of public health, if you come into my state from another state, you must quarantine. Do you have a point?
Also, the airports and the airways are regulated by the federal government. So the states don't have any real authority over flights coming in or out. That's all determined federally. Hence how we wound up in this mess to begin with. They were asleep at the switch. They did the China travel ban. They waited until March 16th to do the Europe travel ban. So we don't have, this is as far as we can go.
But has your office reached out to the airlines, JetBlue, Delta, et cetera, to encourage them to make announcements on
Yes.
flights from Florida?
Yes. Oh, no, people will know about it. There's no doubt about that. But unless I misunderstood the question, it doesn't say a person from one of these states can't come. No state has said all through this, you cannot enter my state from another state. I don't believe that would be constitutional. A state can say, if you enter, I have a public health concern, and therefore you must be quarantined.
Governor, I was wondering if you can react to last night's primary results. Looks like at least 5 incumbents in the Assembly are in trouble. You know what happened with the congressional seats. Something seems to be happening here. Is there a restlessness within the party to kind of move it to the left? What do you make of it?
I think you've asked me that question every election cycle for the past 3 cycles. Something's happening here. I'm watching social media. I'm telling you, something's happening. I feel it. I have my political antenna up. I feel it. I don't know. I haven't really studied the primaries. There's no doubt. There's an awareness. There's an awareness that's up. There's an energy that's up. I think it's all good. I think after this George Floyd murder, I think you're seeing a reaction to that. You're seeing a reaction to the injustice that has gone on for too long, the racism that has gone on, the discrimination that has gone on, an out-of-date police system and public safety system. You're seeing a reaction to that, certainly. But I'm more focused on November and the general election. I think that's where you need to have change. You want to make real change, you have to change the President of the United States.
Governor,
Zach?
20% local governments are concerned about with the state withholding 20% of payments this week. When is the real drop-dead date for enacting 20% budget cuts you've mentioned, as this whole federal stimulus aid remains up in the air?
It would be incremental, but there is no drop-dead date. We're dealing with an annual budget. So the drop-dead date is what you declare in some ways, Zach. If you conclude that the federal government is not going to provide any aid, period, and these are the numbers, then you would act on those numbers, but we're not there yet.
Following up on that, the mayor said today that New York City could lay off about 22,000 municipal employees this fall as a result of the shortfall. Does that change your thinking at all about allowing the city to borrow money?
Did he say he will?
Might.
Oh,
Could.
I don't know what that means. What was your exact question?
Does that change your thinking at all about allowing the city to borrow money to cover its operational expenses?
The question of the city's finances has to be analyzed as we go forward. You know, we've seen the city get into fiscal trouble before, and the state had to step in. So it's not just that the state has a legal authority over the city, and that's why the state has to approve borrowings, etc. Because legally, the city is a creature of state government. Legally, we're responsible. Fiscally, we're responsible. If a locality goes bankrupt, you know what happens? The state has to take it over. That's what happened in Yonkers. That's what happened in Nassau. That's what happened in Erie County. A state could never allow a locality to go bankrupt because it would hurt the state's credit rating. So when a locality gets into trouble fiscally, then the state has to come in and assume it. So that's why we're very diligent about the decisions that are made, because ultimately we would have to come in and take over. So on the city, we have to see what happens on the federal side, and we also have to gauge how quickly the city's economy rebounds. And that's a factor of 2 things. One, forget what we do with the phasings of the reopening. When do people feel confident to come back to New York City and to start to invest and go to restaurants and go to bars, etc.? When does that happen? That people who are now out on Long Island or in the Hudson Valley decide to come back? When do businesses really tell their employees when to come back? You have a lot of businesses who are basically telling employees now, well, you don't have to come back until September. I discourage that. we need people coming back. We need energy. So one of the functions is, when do people start to come back, and when does that economic energy come back? The second is, and what I'm going to focus on is, what can we do to reinvigorate the economy? What can government do? What can we invest in? What can we build to stimulate that economy coming back? So it's a multifaceted issue, right? So you have, what is the federal government going to do? When are people and businesses really going to come back and reignite the New York City economy? What can government do to reignite the economy? And then there's a fourth, which is the intangible. How do people feel about how the city is doing? And do they think it's on the right track? Do they feel positive about it? Which is harder to quantify, but that is very important. Consumer confidence. People need to be confident in the place and the operation of the place. And that is something that is also a work in progress.
With the travel advisory, it seems like it's an honor system until you get caught or called out. I mean, other states like Florida, they make travelers fill out paperwork with their address, or Hawaii, and then check in on them. Have you considered doing that? And also, if I go to Florida and then I come back to New York for vacation, do I have to then quarantine also?
Yep. Yes. Second part is yes. One, you could argue that every law is the honor system until you get caught, right? You can speed in a car until you get caught, and then you get penalized. So that's almost any law. Yeah, you can violate the quarantine until you get caught. And then when you get caught, you're in mandatory quarantine and you're fined thousands of dollars. So, yeah, you can break the law, and if you don't get caught, you're fine. But that's a big if, right? You go to a business meeting and somebody says, "Didn't you just come from Florida? Aren't you from Florida?" "Yes, I am." And they drop an email or make a phone call. Now you have an issue. You get pulled over by a police officer. "Oh, you're a Florida license. When did you get here?" Can't lie, because he can look it up. The Port Authority has all the records, and the Port Authority is going to make all the travel records available. So yeah, you can break the law until you get caught.
Our Buffalo friends are asking, did you speak to the Blue Jays organization?
Contact tracing.
Track people, who are you? I get your info, and then if there's a problem, you get a test. We can trace you.
But how would you know, Peter, how would you know if they test positive until you have a second encounter with them? You know what I mean? You come in on a flight, I have your info. I'm not going to know what happens unless you get tested somewhere along the way. And wherever you get tested, then I have your info.
But you don't know that came from Florida. Is that relevant, or is that not relevant?
It's not really relevant, but when you get tested, we will then have you and your test and your address and all your information. And that's where it really starts.
And our Buffalo friends are asking, did you speak to the Blue Jays organization about conducting spring training in Buffalo or Western New York?
I don't know if that conversation has been done yet.
On the issue
Last question, Mr. Sif.
Yes. On the issue of malls and gyms that you brought up, they were originally planned to be part of Phase 4.
Yes.
Do you now anticipate a Phase 5, or do you think that something like malls and gyms may not be able to open until there's a vaccine?
We don't know. Dr. Zucker, Health Commissioner, who has guided me through all of this, studies the data, wants an informed decision. We're not saying Phase 5. We're just saying we've gotten some new information on how the virus spreads. We're still studying it. We'll have a decision as soon as we process all the information. Thank you for letting me take off a couple of days. I know you missed me. I got many letters saying that you missed my presence and my smile.
How does it work in a baseball players coming from Florida?
The police committee, the Major League Baseball and spring training, we agreed to last week. Days all run together. I believe it was last week that I announced it. The health commissioner is working on a health protocol with them, and we started that last week. And that'll be separate to a separate protocol that's done through the state, between the state and the two teams, or whatever teams come back from spring training. No, because they're working on a protocol from last week. We announced that. Thank you, guys.